Welcome to Cups and Courage, the podcast. Today's guest is Vikki, and Vikki is a global leader in breast cancer care, and she's also an award-winning nurse specialist. She leads a specialist team at Imperial College, and she also advises on breast cancer storylines in film, TV and radio. She's actively involved in shaping international research and practices. Cups and Courage, the podcast. Hello, Vikki. Thank you for joining us today. Really excited. And given your reaction when you brought the biscuits in this morning, I am so excited to see what you've brought in. Very curious as well. So here we go. Hold on.
There's been thought.
Okay, here we go. So, because I said your favourite, so you've really, this is your favourite?
It is my favourite. It's my. There's going to be explanation.
Love this. Here we go. Vikki. Okay, I'm going to say this. I'm going to say it once. These are my favourite.
I can't breathe. But there may be a twist. There's been so much thought.
Okay,
About which version of those was
so I'm
coming.
holding it, and I know the camera can't see it, so I'm going to just hold it up now. These are Fox's
Yes.
chocolatier than chocolatier chocolate biscuits.
Enrobed. It is a biscuit which is enrobed. Thank you. Enrobed. But in my head, you see, white chocolate. I love white chocolate.
Okay.
But I thought, no, you can't go white chocolate.
Thank you for not doing that, because it's a bit sickly. I would have
Yes.
found it sickly.
However, there's a bit of a twist with this. Let's see if you can
Okay, so I want to bite into it, but I'm going to break it. I can't.
snaps.
Honestly. I don't think I could love you anymore at this point.
So this one, apparently, can you taste salted caramel?
Yes.
Yes?
Yes, I can. I didn't know what that was until you said it's salted caramel.
Now, this is absolutely my favourite. And I have been known even, this sounds a bit quirky, just to eat the chocolate. Because I'm not really that much of a biscuit person. So actually, for me, I think this is more about the chocolate than the biscuit. Although, back in the day, I did like a fig roll. Fig roll?
Yeah.
Or 1980s,
Yeah.
Garibaldi.
Okay, you're going to have to help me with that reference. What's a Gary? I think our
Squash
team
fly.
Yeah, we've mentioned this before, and I think I had the same conversation that I didn't know what a Garibaldi was at that point either.
Wow.
And it's gone in and out again because I've forgotten. So tell me what a Garibaldi is.
Well, it's flat.
Okay.
But it's got, I don't know if it's sultanas or dates is a fig roll, isn't it?
Yes.
So it's that sort of, I think it is like a sultana squashed. It's a flat biscuit.
Do they still stock them? Can you
I'm
still
not
get them?
sure.
Okay.
There's a challenge.
Right. I'm on it. I can't get over the fact that you brought my favourite biscuits.
I'm so pleased. So much thought went into this.
People keep saying to me, they say, well, what are your favourite biscuits? And these are them.
Yeah.
These are them. So thank you. I don't actually think I've had a salted caramel. We should probably move on because I'm going to talk about biscuits for the next 45 minutes otherwise. So thank you for bringing your biscuits. Thank you for bringing yourself here. So the next tradition that we have on the podcast is we ask our guests what their own definition of courage is. So over to you.
Yes. So I think courage is personal to each person, really. I think it changes through time. I think it is swimming upstream a little bit at times. I overthought this a touch because I think, looked into what is it, and there's all these different definitions of courage. But I think it's more of a feeling. It's something, could be something spooking you, frightening you, but doing it anyway. But with mindful intent. not just like being shoved into a room, oh gosh, this is frightening, but actually thinking about something, a situation, and purposefully walking into it and doing it. I think it's that sort of more of a feeling, really.
Thank you. Next, let's talk about you. Let's talk about you. I'm so excited to have you. I did a bit of Googling, a bit of stalking. It borderline stalked.
Your algorithm's going to be a bit
wonky now.
Haywire, wonky.
But yeah, if you wouldn't mind, our listeners, can you give us a little overview of who Vikki is and your connection with cancer, breast cancer?
Yes, before I go off on a tangent about basket weaving or something. No, that's not me. So I'm consultant nurse at Imperial, head up the breast screening and symptomatic units. And I have been working in breast cancer. I covered for someone's maternity leave in 2000. So
we're still here.
This is where we are. Just won't go away. She doesn't get the message. No, and I absolutely loved it. I was determined not to do anything medical. Parents are both oncologists.
Okay.
Yeah, so I wanted to be a geologist on an oil rig, something like that. And I was a bit spirited, shall we say, at school. And I went into nursing and I loved it. Absolutely loved it. I loved the odd, quirky time shifts, the jolly hockey sticks. It was better back then, there was a bit of fun. You bring the ties or I'll bring something else, real sense of team. And huge privilege. And I was in oncology from the get-go, really, on a ward, and then surgical oncology. And then, in 2000, I went as a specialist nurse into breast cancer. It was the picture of the old Rembrandt, Bathsheba at her bath, you know that?
Yes,
yeah. So that got me into it a little bit, really.
Okay.
And it's quite a romantic story, isn't it? Because it's the Rembrandt depicting, isn't it, what he saw, and in the, of course, upper outer quadrant, as most of these breast cancers are. Obviously, a cancer there. She lived for 9 years after the picture, so I don't know whether it was actually or anyway. So that. So I've been into breast cancer since 2000, and love it, really. I think it's incredible honour and a privilege to walk alongside women mainly, some men, as they're facing potentially life-threatening disease, trying to make the situation easier and more bearable. It's incredible. I think I've been quite lucky. Having said that, I think you make your own luck a little bit, but had many opportunities. So alongside the day job, I've been invited, I suppose, to write books and chapters. And I suppose the most exciting thing is script writing, medical advisor for some TV shows and films. And then some charity work. So, Copperfield Medical Advisory Group and Deputy Chair for Europa Donna UK and Trustee for Against Breast Cancer, which is specifically for metastatic breast cancer. Yeah. So, but really do it with the support of a brilliant team. That's how you do it, really, isn't it?
It's quite wide, actually, when I hear you, because I also know that it sounds like you've normalised a lot of that incredible work that you're doing. That's a huge amount of impact. Consulting as well, and making sure that information is correct, credible, and accurate. Providing leadership for a team of people and enabling them to do the great work, and making everyday change for people. I feel a bit small.
No, I've just been around a long time.
But it's also 25 years. So, 25.
That's right. No, that's right. And it is taking this, and things just can go on to the next thing, onto the next thing. And I have been incredibly lucky. Maybe it's the time, but also being enthusiastic and actually smiling a bit of waffle goes a long way.
Well, yeah.
But you have to also deliver. I mean, again, it's been amazing. And the invitations I've had, again, sort of teaching I think I'm a real one. History boys, pass it on, boys, pass it on.
Yeah,
I
yeah,
love that.
yeah.
You know, no, I'm just going to keep things that I've know to myself. No, absolutely not.
Yeah.
And a couple of people looked after me as I was going through the ranks, and that has really stayed with me.
Their ways of looking after you, do you mean?
Yeah,
Like,
nurturing.
yes.
And so you try to bring people along with.
Yeah.
So I do quite a lot of teaching as well. So sort of in the UK, and also had wonderful opportunities sort of internationally, done a lot in the Middle East. Australia, I think that was the biggest thing I did for the McGraw.
Brilliant.
Yeah.
Honestly, it's huge. It's okay. So this is going to be a really tough question then, I suppose. But what's an area of the work that you really enjoy? You know, whether it's rewarding or whether or not it's fulfilling. Is there something that you go, right, that's the stuff that lights me up 25 years later?
Yeah, it's patient contact.
Okay.
Really, really does. People to people. No one reacts. You know, when you're out there, a diagnosis of, as I said, potentially life-threatening disease, it's no one reacts the same. And that's still brilliant. And that we're all just so different. There are, of course, some similarities. Oh, this is... and you try and dovetail your support and information to that person and that time. Don't want to overwhelm it, isn't it? What do they say? The most experienced person, I'm not saying I'm the most experienced, but gives someone the least amount of information, but just the correct information for that touch point.
Oh, I like that.
Yeah.
I don't do that. But I think that I hear that, right? So the person who's most experienced actually is what you need to hear at that moment and really clear rather than overwhelming.
Yeah. It's what I didn't do, I think, in school exams. You know, we answer the question.
Yeah.
I'll just tell you everything I know about breast conserving surgery. No, don't want to know about that. What I want to know about is this. Yeah. So I think that's important. That's my passion. I really think so. The actual patient contact, because of course where I am, we use quite a lot of sort of service improvement and strategic stuff that you also have to do, and gets in the way a little bit.
Yeah.
I lead a marvelous team, but and that's fabulous as well, having time with individuals. But again, really, patient contact is my thing. That lifts me, absolutely. Yeah.
What's the stuff that is more challenging for you? So I've heard, the red tape or some of the more strategic kind of that stuff. Are there areas of the job that are tough? I can imagine being with patients and hearing those stories, and I haven't got a clue how if I think about my clinical team, I've not got a clue how they do the job that they do, because that's heavy stuff, and so I suppose it's a balance, isn't it? I've not asked you one clear question in that. I've just literally spoken at you, but
I'm with you in the sense of it's emotionally could be draining.
Yes.
And I think the biggest snag for me is, this is going to be awful, but NHS, the workings of it, the red tape, everything takes so long.
Gets in the way.
Yeah. And there is no one is not working really hard in the NHS. It is brutal.
Yeah.
I don't think that's too strong a word. Now, I'm NHS through and through. I love the NHS. I stand by it. It works when it needs to. But it's relentless. It's extraordinary, the pressures. So that's one aspect. And I suppose, of course, then there's the other, which is the more emotional, dealing with people, with having their reactions and seeing how you can help. And sometimes you can't at that time. People are coming in all sorts of sort of states and stages. Certainly after COVID, we saw people people are more vulnerable, I think. And I don't know whether that's because maybe during lockdown people were sort of really thinking about how they were feeling, as it were,
more time on their hands
more time to think, and then we asking people, they're going to tell us.
Do you think there's also that isolation piece though in there? Because actually, going through treatment, or going through any kind of part of your medical journey, not being able to bring the people in potentially that would necessarily buffer you, and then suddenly I've got to do this on my own. I've got to go and show up, and that sense of, I don't know, lack of connection, masks and everything.
Well, that's right. Masks and no touch.
Yes.
Not saying that you always, touch. I mean, there's a place for touch.
Yeah.
And not bring people. And people did they? People didn't come in. They didn't want to bother us.
Yes.
But then also they thought, I don't want to go into hospital. My gosh,
Yes.
people, have you seen the pictures of the thing?
Yeah.
I mean, we kept our doors open. Of course, we saw less referrals, less people coming in. I mean, I was redeployed to ITU as well, so we did that 1 day a week as well. I mean, that was more like Dad's army, trying to hinder. But it was extraordinary. But I guess the emotional piece, it's not happening to me. It's I'm here for someone else, not about me. And if there's anything I can do to help someone going through diagnosis and treatment, then that's got to be a good thing. That's my job. Sure. Every now and then someone will get to you a little bit, and it's mainly maybe if they're your age, or you can sort of identify with them, or if they remind me of a family member or something. Same with us all, and thankfully for that, because otherwise it would be this sort of like
robots.
That one-dimensional. Oh, hello, come along here.
Next.
You mean you're not feeling great today? No. Funny about that.
Yeah, I think it is really interesting, but and I think my perspective is well, clearly, obviously different because it was all encompassing, especially when I was going through stuff. So there was an assumption that actually I was just giving everything to my team, and actually there's far more internal strategies that would be in place so they wouldn't take all of that on porously, just feeling it all. Because I can't imagine anyone being able to survive through that
you can't. And I suppose working with the team as well, you can try to help other. I mean, we've all got our coping strategies. And at the end of the day, as I said, it's not about us.
Yeah.
It's about the person who's in front of us, who we're trying to help and support, and that's our job. But nursing is different to that in the sense of we're exposed to the softer sides of people. Yeah. And potentially, I don't know, but possibly clinicians are more there with solutions. And this is the trajectory of treatments. So what's going to happen is you're going to turn up here, and we're going to do the surgery, and then we're going to check the wound, and all these steps. Yeah. Whereas the nurse, and then they say goodbye to the oncologist. Then you're on to the oncologist, usually, isn't it? If you have that sort of mainstay of treatment with the surgery, and then potentially adjuvant oncology treatments. But otherwise, the nurse is the constant throughout, the clinical nurse specialist. So she straddles all of those arenas, and really is a patient advocate, and say, well, I don't think that they'd like that, or I don't think, let's find out. And so there's a much more of an emotional side to things. And it is the job also within the skill set to try to help with the other parts. What's with all the holistic needs assessment, what's your biggest worry? What's your fear? Is it talking to children? Is it, actually I'm the breadwinner for the family, or I haven't told anyone, or it's
such a vital role, and I don't want to say it gets overlooked, but actually without that role, I think the whole system would fall down, because you would just be passed to these gates, to get this bit done, but have a sense of consistency and continuity and care. And I remember feeling like I was taking up too much time, because other stuff, I wanted to go, right, what do I need? And I'm fine, it's okay. But actually, the ability, that emotional intelligence that's required in that role, to be able to see underneath or read between the lines and what someone else might need, not what they're saying, how they're saying it, vital.
Well, that's right. It's the emotional intelligence, isn't it, to see and to probe when you might not probe all the time. Someone might not be ready, because you've also got to ask a little bit of permission before you probe further, because someone may be, their denial at that moment is how they're dealing with it, and they don't want to be in tatters because they can't. They're not there.
Absolutely.
So it really is individual, and with the, you know, as I say, emotional intelligence, trying to see how someone is really, and also the interaction with family. Anyone who comes, but you mentioned earlier, you know, they're on their own during treatment, how they are with others, you know, it's extraordinary.
How someone would show up with a partner or a family member versus what's going on for them on their own as well. And
that, of course, is a dynamic changing the whole time.
Yes.
It's not fixed because of because we're all humans. It's
Yeah.
just, it's mindful, really. I'm surprised how it just keeps going.
When we talk about it, I'm like this, we go,
actually, how am I? No.
Yes.
That's, I suppose, another piece to courage, because it's just showing up, just keeping going.
Yes.
It's always courage, keeping going.
Yeah.
Really, in the face of whatever it is, and it doesn't have to be big things. It can be joyful things as well.
Yeah. Let's talk a bit about what your key messages, or what do you advocate for? What's important to you as, you know, leading a team, being fairly influential in your space? What are the things that you would like to see change within the healthcare system? If you could have a magic wand.
Yeah.
Right.
There's so much to do with the system.
Yeah.
But it's also what we're left with. Yesterday I was walking through the hospital, and I thought, I always think of like how it must be to be a domestic, because you're in these old buildings, and the heating changes, the temperature of each corridor is different.
Yes.
And some windows don't open, some don't close. And I always think, if you're a domestic and you're trying to clean, like how frustrating, because it's never going to look nice unless you're in one of these swanky new builds.
Yeah.
So the hospitals themselves aren't great. I mean, I'm thinking of space.
Sure.
Because sometimes when we can see after a consultation, oh gosh, someone needs a bit of input here. This sounds wrong, but sometimes we have these snippets of conversations in corridors.
Yeah.
I mean, don't get me wrong, there's good bits about that in one sense, because that could be a little bit stealthful, rather than let's march you into a room and shut the door, you know, like, oh my goodness, now what? I'm not ready for just sort of like snippets, and then, let's... I mean, we have a Maggie's within the hospital grounds, so we can always come down. But time as well. It's the luxury. That sounds bad. The luxury to spend time with people, as much time as you want.
Yeah.
And to all the people, like you saying, was just saying, no, I'm fine. And I mean, they do also say that healthcare professionals sort of 90% of their time on 10% of the people.
Yeah.
Because of people who may have different needs, or maybe more vocal about their needs.
Yeah.
So I think it's time and space. I mean, to be honest.
Real practical things.
Yes, I do think so. There's all sorts of special, clever things that we could be doing also, in the sense of different clinics and stuff. And, it's not just a case of always having more nurses, because you can't, you just got to try and work a bit differently, work a bit smarter.
Yes.
But there's all sorts of clinics that we could be putting on if we... if we could have a thought and be a bit more proactive and sort of future-proof for the service, what can we do? Foresight. At the moment, I think we're a bit reacting, because the amounts, and that's one of the good things is that we've got so many treatments for breast cancer because of big numbers.
Yeah.
Right? And because of clinical trials, we've got good trials, and so so much in our armoury. It's incredibly sophisticated, all of the treatments, and complicated, which is wonderful as well, and really personalising the care. So we've got our work cut out.
Yeah, because in one breath, it is future-proofing, right? It is going, right, what are the things that we can offer, and all the research that goes into that. But equally, it's someone used to say to me, it's like trying to change a wheel when you're going at 70 miles an hour. You know, there's only so much you can do.
Yes.
And so business must continue. We must carry on as well as we can do, given what's going on. I remember it was actually in Oxford, I was having radiation and had a really tough, basically, I think, you know, this is my memory not great here now, but there to where they put the dots, basically, but you have to breathe, and they'd measured it on the wrong side of radiation. So when I came in to have radiation, I was, you know, what should have been a very easy first session was very traumatic because I kept being told that I was doing it wrong. And it's because they were measuring it on the other side. And so I got myself and this is after lots of treatment and lots of chemo and kind of, I was really adverse to being touched or laying anywhere, you know. So I was already not in a neutral space, but I remember coming out of that session, which again should have been 15 minutes, and I was in there well over an hour on my own, you know.
Yes.
And I was so upset and panicky, and the nurse grabbed me in the corridor, you know, she said, and I didn't need to go into a room, but it's that moment, those moments of connection, and we are humans all the time, you know. So when you see another person in need, and especially in those environments, you know, you're either in need or you're giving care, you know, and so just to be able to create those moments, vital.
That's so interesting, and I'm sorry you experienced that, and that's so articulately put, and I love that neutral space. And of course you're not, and I so get the point where it's just fed up of being touched or
prodded,
do this, prodded, and but I mean, lie here and lie there, that's extraordinary. And like them, no, I'm not, you know, that's not right, that's okay. Not right. The frustration and the
But it's those moments. So what I remember most is the woman, the nurse that caught me in the corridor.
Yeah, thank goodness.
You know, outside of the faces of anybody else. I don't remember, you know, I remember my own feelings, but I remember that moment. And we don't know the impact that we have on other people at their time of need. And so, more rooms and more space to be able to, you know, have those more enhanced conversations, great. But actually, in the absence of that, a corridor conversation will suffice.
Yes.
A sensitively had, you know.
And that's kind of a case in point in the sense of, had someone frog marched you into a room, that might have been the last straw.
Exactly.
Whereas just en passant sort of.
That's it. I'm still a human. Yeah, brilliant. Okay, so I'm really interested because I know you travel a lot. I know you do a lot of international work. What are some themes you see, you know, country to country, whether it's patient, because I don't actually know a lot of the work that you're doing overseas. So you're working with teams over there?
Yeah, it's different really. And it's been all sorts of different things.
Yeah.
I've done a lot of lecturing, I suppose, for different drugs have come out. So sort of rolling programs. I did a lot in the Middle East, so Dubai and Kuwait and Saudi and Oman and Adan. Really brilliant. So going out, and we did sort of a big 2 or 3 day session on different drugs, how they work, whole of sort of breast cancer really, and then modes of action of drugs. And then we did a sort of communication and case studies. So I did sort of that on a circuit for a while. And this is in my own time, right? So,
okay.
And then, so that's teaching really, and you get to speak at different conferences as well, or chair sessions. But what I've sort of done most recently is working for low to middle income countries. And I'm going actually on Sunday to India for the 3rd time to help with this awareness program. So there's a group of us from the Association of Breast Surgery and International Forum, and we partner up with, it's a cement foundation factory, and they give some of their money back. And it's incredible the work that they do, in the sense of it was in rural India, little places. And I remember the first time I did it, they had a sign up: when you get bitten by a snake, not if, when. Oh, slightly. Oh, yeah. But so there's three pieces to it there. We're teaching a lot of the doctors out there, and then the Ashers and Sakis who are sort of A-level standard educated people who, there'll be 200 of them, will give the essence of what breast awareness is, what to report, breast cancer, and then they will go into local villages. Okay. That's the piece, as sort of health workers, and encourage women to talk about any issues that they've got. And then I think on the third day, there's 100 women who are high risk or who've said that they may have issues, who this factory, the company, have brought in, transported in, and we do sort of a health camp in the sense of screening for anything breast issues or diabetes or and all sorts of things. So I'm passionate about low to middle income countries trying to really tackle inequalities in health, because I think a lot of life is luck of where you're born. It's incredible. It is absolutely incredible. And then just in the tail end of last year, I was in Zambia doing similar. And so, on the whole, sort of self-fund and take annual leave. And then, go out and help. And it's incredible. It's incredible opportunities, and it's so colourful, and it is just really enriching. It's amazing. Some of the travel is a bit harebrained. I get slightly anxious about it. And I'm really well travelled, but the amount of people, certainly in Mumbai airport, when you're trying to find where to go.
I've been to Mumbai
airport.
I know. Although not as I was in a Bollywood movie once as a dancer, so not altruistic at all. So mine was very much, glitter and fake tan for me. So but I have experienced Mumbai Airport.
Yes.
But I didn't I didn't realise that was a you thing. I didn't realise that was you going, no, I care about this. Yeah. I'm going to take my time, the time that I have, and this is how I want to spend it.
I really believe in it. The aim is to increase awareness. I mean, will the infrastructure hold if people do come forward? Yeah. And again, they see people through and ensure that they do, and anything is picked up. But it really is, I mean, just in Zambia, my goodness, we sat in on a breast clinic, and it's the old classic, people presenting so late, clinics, and you can smell that someone has a fungating wound, and then it's incredible, the inequalities in health. And I do a lot, just remind myself with people with learning disabilities. Okay. So over the years, and again, you get into that virtuous circle.
Is that here or right? Here,
okay. So you get into that virtuous circle. You get people who, we did one thing, and they said, "Oh, can you do a bit of piece on breast awareness?" Now I pitched it wrong. I was there. It was shameful. PowerPoint, this and that, and no one was. Some people were communicating in clicks. Yeah. And it's like, oh my goodness, that was so informative. Because then we did health fair, and I again was breast. We had someone, a dietitian, we had a podiatrist, dentist, people, the sort of stations. The next time. You just sort of learn and do more. And then we did some more work. Exactly right. You get in, as I said, this group of people, and we ended up doing. There was boobs and bingo was what it was called. So you got to rate, interest people so they come for the cake, because there's a lot of pink. Like it or lump it, it's there to stay. The pink tsunami. Yes. Everything is pink for breast cancer, and everything really has cake in it. But it attracts people. It's so unhealth promotion, isn't it? We did, boobs and bingo. So there's cakes. We did this with a lady called Maura, and she's off the hook, brilliant. And her sister-in-law's got a bingo machine. Yes. Okay. So I do the breast awareness bit with the false breast and And then we have,
bingo
with pound shop prizes, etc. But we've also opened up Imperial, so some of the breast screening centres, and invited people with learning disabilities in, looked, to demystify it a bit. This is the machine. This is. So again, with the hope to address inequalities in health, because people with learning disabilities are less likely to come to screening. Positioning is difficult, it's awkward. The ability to communicate how you need to be and why. Yeah. I mean, actually, thank goodness it's not cervical smear test. I mean, we're lucky with, because breasts on the whole, it's a little bit less intrusive, but all the same, it's
personal.
It's something that you usually don't share with many people.
Well, it's really interesting, isn't it? Because I think there's this piece of awareness, but actually it's getting people into a space where they can hear in the first place and meeting where they're at. So whether it is through bingo and cake or coffee, it actually the method to engage.
You will never know, though. That's the bit of a difficult piece, actually. For it's sort of for awareness, health promotion, because you never know when, oh gosh, that annoying woman and her pink cakes barging in the whole time, year after year, October mainly. When that hits home and someone goes, actually, I mean, this is years ago and it was all in Hello magazine. I'm not breaching confidentiality, but I helped with the scripts for Coronation Street. And of course, as these things are, she was going to be diagnosed on Christmas Eve, and and we had it all crafted out, and the actor who played the person actually had a lump, and she thought, well, no, let me get this checked out. And then went off with breast cancer. So we had to recraft the whole thing. It was to be chemotherapy, it was to be all of it. Then it was like, oh, did you see that? Oh, they've just moved, because they had gone off sick to have the treatment. So and I'm so aware that because of the numbers of people with breast cancer, you've got to be so. It's delicate, because then suddenly, like I'm saying, Christmas Eve, suddenly you're watching a TV program, a soap, and it's suddenly in your front room, and it's like, oh, this is now, how it's affected people. So it's incredible. It's a real responsibility. And again, with these shows that I have helped with, it's not a documentary. You have some artistic license, but all the same, the viewers need to be sort of self-aware. So again, you never know about health promotion. But it's an opportunity. And I mentioned October. I make it my business to think, where I go into Harvey Nichols, or a bit local prisons, all sorts of everything in between. To try to raise awareness. And that's a bit also that I love. I think if you're also, you mentioned that is something that I really am passionate about, breast awareness, going to places, going to offices, to promote breast awareness, and reporting of anything, any aberration to the normal. People are the experts of themselves.
Absolutely. And I think it's also catching them where they're at. So in a workplace or in prison, actually, they're not in a hospital having it done. It's part of their life, and it is part of life. And so how, as you say, how do you demystify that? How do you make it normal, sensitively so, because it impacts so many of us. And actually, people coming to an event may have lost people. They may have had other experiences with cancer. So it's a real... I can imagine there's a lot of things to consider.
It is, and especially if it's October and perhaps an organisation is doing Wear It Pink Day, and it is meant to be a bit fun. But as you say, and upbeat. The talk's a bit upbeat, and maybe there's a funny slide in the thing, or these are they're lemons, and they've got lemons that have got issues as opposed to
boobs.
Boobs. Then it's like. Actually, and I always say a little bit, really aware that people may have had exposure to this and everything. I mean, you've just got to try and be as authentic and transparent. Everything is said with such sensitivity and respect. I mean, and I think that's credible. Having been in breast cancer, working in it for 25, 26 years. That it absolutely is said with respect.
Well, the intention is very clear. Then it's not about the the method. It's about the point of raising the awareness.
Yeah,
you know.
but yet in a fun,
Yes.
sort of sometimes playful
Yep.
way. I mean, you bring around your prostheses, you know, false
Yeah,
breasts,
yeah,
and pass it around the audience, mainly to make sure everyone stays awake.
Yes.
But,
Interaction.
yes.
I know. Can I ask you your personal opinion on the pink tsunami?
Yeah.
I've not heard that phrase before, by the way, and I really like it. I understand it because it does. It's a wave in October, and it quietens down again. Although, you know, for most of us, it's a continuum.
Yeah.
But there is a definite amplification for 31 days of the year.
Yes.
And I wondered what do you think about the pinkness and the, or do you have an opinion about it, or is it just it's just part of the...
Yeah, I think we're lucky to have it. I have those mixed emotions. We're lucky to have it because it is a huge, great vehicle to get breast cancer in the public domain.
Yeah.
I think celebrities perhaps are eager to champion breast awareness. I think it's slightly carry-on film, breast cancer. I mean, you know, you're not saying stomach hair, bowel cancer. Yeah, right?
It's very true.
But also the demographic, it's, you know, like stomach cancer, lung cancer. It's a more a louder voice of person, I think,
Okay.
to do with breast cancer.
Yes.
So it's a really useful vehicle. It's one that, gets us out the house a bit, go on little outings, but I'm in tatters by the end of it, a little bit.
Yeah.
It's interesting you say about the pinkness, because yesterday for International Cancer Day, I said, shall we do something fun? You know, to the team at work, and someone saying, we can wear t-shirts, pink t-shirts. And then people were like, I don't like pink, you know. And so similarly, you know, it certainly wasn't mandatory, but some of us did.
As I speak to people, I think survivors of, you know, people with lived experience, it's like anything, right? You fall into one of three camps. You either feel very strongly against something, you feel very strongly for something, and you're a real advocate for it, or you're in this kind of space where you're aware of it, but it doesn't really impact you.
It's interesting, isn't it? And I remember thinking was always, I've done a lot of sort of talks, I suppose, on secondary metastatic breast cancer, and that is a different vibe in my view. It's like pink tsunami, breast cancer, breast awareness, you know, and then it's any sort of secondary metastatic breast cancer. It's head on the side, quietened voices, hushed conversations.
Yes.
But actually, it needn't be the case.
Yeah.
And isn't it? It's the 13th of October is, you know, which always makes me think 13th.
I know.
But I mean, you know, it was meant with good intention.
Absolutely.
The older I've got, the more I realise that actually, just round the edges a bit, I don't think anyone's meaning to be...
Yeah.
It's maybe clumsiness sometimes, and I think this is the same with perhaps interactions, healthcare professionals with people going through treatments or people after it with the lived experience. It's like, you know, realising that things aren't meant usually.
They're not.
Things are meant with good intent, maybe a bit clumsy.
Yeah.
But that's it, and I think that's a piece which years back, and in my personal life as well, you know, you might have realised a bit earlier that actually none of this resentment sort of, just things are meant just soften the edges a bit.
I agree. And I think, I don't know if social media has kind of influenced this, but I think we've got to be very aware of, because it's not just our experience, we're aware of our next, you know, the people around us, those experiences. And I definitely have been, you know, good intentions, but absolutely know that I may have inadvertently, you know, unknowingly been a bit clumsy at different places of my journey.
Yes, but similarly, I mean, it might not have been the places that you're thinking of.
Absolutely, I agree.
I mean, isn't it?
Yeah.
It's like someone said to me, she was a patient actually, and she came back and she said, I mean, it's like 10 years later, and she said, you know, it was recently, I'm so sorry, I shouted at you.
Wow.
And I hadn't remembered at all. And she said, I've been carrying this. I've just felt so bad, not the whole time, but just, you know,
It's
en
on the back-
passant every
yeah,
now and then. It's
yeah.
like, oh my gosh, I shouted at the nurse. And I was like, oh my goodness. So again, it's not,
Yeah.
it's just, isn't it? I think life's brilliant. It's just so
It is. And moments like this where we
unruly.
can have, it is unpredictable. And,
Yeah.
but moments like this where, you know, genuinely, I'm so grateful to, you know, sit opposite you and have this conversation. I emailed you, and it's back to what you said at the beginning about just being open and sometimes that smile and going, yeah, why not? You know, because you are formidable.
Oh no.
And I, well, I know, you know, it was because of Pink Ribbon Foundation
Yes.
that initially, you know, which was excellent. Thank you, Lisa. But you were so open, and you were like, yes, absolutely, I'd love to bring a biscuit and have a cup of coffee with you. And I'll just thank you.
Oh.
Because it's a privilege. Personally, for me, it's a privilege to sit with you and listen and hear your perspective and hear your humanness as well. Because I think sometimes we only know our own experience, and if I saw you in a clinical setting, you know, I might have other things that may influence how I converse with you. And you are a brilliant human with so much to offer, and you give so much for change and for awareness, and you don't have to, you do it because it's who you are. And so genuinely thank you. Brilliant. So we tend to ask a bit of a reflective question towards the end. That's how we keep a bit of consistency in these conversations. So if there was a nurse newer in her career, you know, quite early on in the NHS, where the NHS is as it is right now, and with some of those challenges that you mentioned before, have you got any words of wisdom or things that you would like them to think about?
I would think they are incredibly lucky. I would be so excited for them. I'd say do things with love. Yeah. I am a nurse to my core. It's such a privilege. It's amazing. I'd say do things with love, and also learn to say no to some things, to value yourself as a nurse. I think we tend to take everything on. And one of my things is this really a specialist nurse job? Can you get others to do it? This is what healthcare is going to be like in the future. We're going to have cancer support workers. They're coming in now. We're going to see more of them. And bring people along with you, do things with love, and keep questioning, nursing is, Florence Nightingale said, now this will be the best thing. I used to finish every assignment off with a Florence Nightingale quote. I've just remembered this. I'm sure it drove my tutors bonkers. But Florence Nightingale said, the cornerstone of nursing is vigilance. So I suppose be vigilant. Be vigilant, bring people around you. With you.
Okay, so I'm going to ask on this vigilance. So in what respect? Vigilant with your own, what's going on for you, or but awareness of others? What's the context of vigilance in that?
I suppose all of that, isn't it? But you can't be like a meerkat and vigilant.
Right,
I'm
right.
really being vigilant now, super vigilant, and internally reflecting with vigilance
all the time.
I think it's a bit softer. Yes, but that's when it perhaps comes more naturally, and you can't. I don't think you can make it happen. I think you just got to be vigilant again with your own emotions. How are you? How are you connecting today?
Yeah,
vigilant with other people that you're working with, and vigilant if you're going down the right path. Is this where I want to be?
Awake,
curious. Awake, because otherwise you can just get on and we'll just do
because the needs, they're going to be constantly put on you anyway. All of that's going to keep coming, the demands. And so I think that's the gift, isn't it, to make sure that you are present and awake and part of that exchange.
Doing the right thing.
Thank you. And thank you for your biscuits.
I'm so pleased because I'm so competitive. It's like, I brought the right biscuit.
Yeah. Tick. Thank you, Vikki.
Thanks, Sam.
Cups and Courage shares honest, personal stories of people affected by breast cancer. The views you hear are those of the guests and host and don't replace medical advice. If you're concerned about your health, please speak to a doctor or healthcare team. Cups and Courage, the podcast.